example, in smokers, their blood vessels aren't as healthy, and so those little blood vessels growing in to survive the fat aren't as strong, and so maybe more of the fat goes away in smokers. So it just depends on the person, but I think a certain amount of that fat's going to probably live in just about everyone. It's just a matter of is it that much fat, or that much fat.
That why plastic surgeons tell patients who are smokers that they should quit smoking at least 3 months before surgery?
That's one reason. I mean, in some surgeries like facelifts, breast lifts, and tummy tucks, smoking can be disastrous. There was a patient, a lady from Saudi Arabia that I saw that was a heavy smoker. A doctor in Paris, I think, did a tummy tuck aggressively. And she, kind of below her belly button area, had a hole that a baseball could rest in. Because what happened was all the blood vessels supplying those tissues when it was healing weren't adequate, and the tissue literally died.
It was necrotic.
Necrotic tissue, yeah. And so she was left with, and she wanted me to fix it, but she's still smoking like a chimney. I said, what's the point? It could be worse.
Can you fix that or not?
Not with her currently smoking, yeah. Because there's certain surgeries, again, it's hard to explain why technically, that are really, really, really susceptible to smoking.
My mom was a smoker, and when she had a facelift, one of the issues is she had an issue, not quite that bad, but her scars were never, because she smoked.
Yep.
And then she smoked afterward.
Yep.
And smokers don't heal.
They don't heal.
Eventually, my mom had to have serious medical surgery down the line. The doctor was like, listen, you have to stop.
Yep.
There's like smoking is really.
Well,
smoke.
there's two reasons people say, well, I get it's bad, but why exactly? So, for one thing, the oxygen being carried to the healing tissues on the red blood cells is displaced by carbon monoxide. So all that oxygen is gone, and carbon monoxide is not going to help. And the second thing is nicotine's, it's called a vasospastic, meaning your blood vessels like this big, you smoke nicotine, it goes spasms down. So all the blood flowing to the tissues can't get through. It's a smaller pipe. So some people say, oh, I use the patch. Well, the patch, that's delivering nicotine right to you. That's going to shrink the blood vessels too.
It's the same difference.
Yeah, so that's why it's so bad for the healing process. That's why fat won't last as long.
Well, that's the key thing for anyone, like, stop smoking. Yeah. Besides the fact that we all know it's bad for you. But for surgery, you want to look beautiful, and that's the whole point of doing the surgery.
Well, that's
you want to improve.
I tell people about the running joke about smoking is like, smoking can cause emphysema, whatever, heart disease, whatever, lung cancer, sure, wrinkles. You're kidding me. Like that. But you're quitting immediately in that case.
But smoking does give you wrinkles.
Yeah, I can tell smokers just by looking at their skin.
Really?
Yeah, it's just it's unbelievable. So
how so?
The texture, the color, the just the vascularity. It's just night and day. Yeah, it really ages one's face quite dramatically.
Is thicker skin more difficult to work with than thin skin? Is there a difference
Well, thin skin has its advantages, and thick skin has its advantages. Let's refer to the nose, because that's your thing we've been talking about. If you have really, really thin skin on the nose...
Do I?
Yours is fairly thin, I would have to say, yeah. The problem with that is every little imperfection shows through the skin. If you have really thick skin, you're not going to see the imperfections, but yet you're going to have this kind of a blob.
It's like that more of that bulbous
thing. So it's like, so obviously something in between is nice, So when it comes to facelifts and things, say if you're doing someone's neck and they have a really thick, heavy neck, like Gene Simmons, you can't really define it as much as you want sometimes. Although for a man, it's fine, because you don't want to define it that much, honestly. But if you have this really paper-thin skin, you see every little thing.
Are you considered like the paper-thin skin?
I would have a thinner skin.
And what would I be considered?
I think yours is fairly thin as well. And usually, typically, but not always, fairer skin like we have.
Like blue eyes
is a little bit thinner, more delicate, thicker, oilier, darker, more olive skin.
So it's also a very ethnic thing.
Yeah, definitely.
There are certain ethnic groups that have a thicker skin, or more heredity, or whiter.
Yeah,
whiter,
we're
not
more susceptible for aging, unfortunately, with the blue eyes and the fair skin.
Great.
But getting back to
Can we give us some good positives of blue eyes blonde people, except blue eyes and blonde hair?
That's blonde. But the good advantage is, honestly, that we, with our type of complexion, respond better to lasers and things. Because the darker skin types, you got to be careful with peels and lasers, because there's an issue of hyperpigmentation, which we don't tend to get as much. Now, a lot of women, even fair-skinned women like you, tend to get it because of the hormones, having babies and everything. Melasma, the mask of pregnancy.
Yeah.
Boy, when some people get pigmentation like that, that's a real...
I was lucky I didn't, but with birth control pills too, women get. You get that around your lip line. It looks like you have a mustache.
Yeah, that's a big problem.
Yeah, I think that certain pills do that more so than others.
You're right, right. The huge advantage of the V peel, which I think mathematician Kelly may have talked about today, is it's great for olive skinned people, first of all, and it helps with melasma. Nothing really helps with melasma, the pigmentation we're talking about, but V peel helps more than anything, so it was a big advantage.
Now, would you say that I would be a candidate for the Fraxel, the Pixel, the photofacial, and would I be a V-Pale candidate?
Yeah, potentially. I mean, V peel really does help everyone.
Everyone.
And if pigmentation is an issue, I think it's even more helpful. So in your case, I'd probably do the the Pixel and the photofacial would be great for you.